some people that are not educated, the moment you say, I have sickle cell disease, oh, na sickler, they form something, an image in their head, and that's stigmatization, So it's one, creating awareness amongst people, like what we're doing now. You go to rural areas, we go to secondary schools, we go to primary schools, we go to some universities, and we talk about it. The more we talk about it, the more aware people become about the illness, number one. Then two, ignorance. Some people that are educated, they just don't care, actually. You understand? They don't care. Like what my colleague said, that every child of an educated person, once you have a child, you should take the child for screening, whether you are AS carrier or not. Just know the genotype of your baby that you just delivered. That is very, very important. And then when you're an AS, if you have a sickle cell trait or a carrier, like they say, you must do that. You must know the genotypes, because the early prevention is better, like they said. When the child is younger, that is when you prevent complications and recurrent illnesses that come from the disease. You understand? like they said, dehydration, you talk it into the child. Infection, so malaria, sleep under the mosquito net, so that you don't have infections, even urinary tract infections, dehydration, stress. If the child wants to be the type that wants to play under the sun no, you caution the child. You talk into the child that, don't play with your colleagues and everything because you are special. There's a way you talk to your child. The child will know, okay, it's special. That's not stigmatization. The child can now willingly say, no, I'm special. My father said I shouldn't play football with the rest of you because I'm special. You understand what I mean? By the time the child grows up, he will now know why he or she is special. You understand? So early prevention. Then another thing is, as I've talked about, lack of education. I've talked about ignorance. You understand? Then another problem we have, church. We must put that into consideration, because the church is a big problem that we have. This person has sickle cell anemia. I've been diagnosed of having sickle cell anemia. And then you go to your church, and then a pastor tells you he will pray it out. Miracles do happen. Do you understand what I mean? But we're talking of medically. You understand? If the person, if churches raise awareness program, if every church preaches about it, that sickle cell is not death sentence, it's something that can be managed, it's something that we can live with. If every church has that at the back of their mind and talks to their congregation about it, I tell you, the awareness, because a lot of people go to churches and mosques and all that, the awareness will be higher. You understand? But they have a way of just not going into it. That is another problem we'll have. The church also should be aware. They should be part of this awareness program. If we can inculcate them into it, it will be very, very nice, because they have the bigger audience.